Addiction, first and foremost, is a brain disease. It is primary, it's progressive, and if not treated, unfortunately, can be fatal.
Addiction is a disease. It's funny, some people say, hey, addiction's a disease, just like cancer. What is a disease? But it's not just like cancer. And I think that sometimes that's where a stigma comes in.
Addiction is a disease that impacts the brain's functioning.
Addiction to me is a brain disease. It affects many people. It makes a person beholden to a substance or an activity that can potentially cause a lot of problems in their life.
Addiction is a neurobiological disease occurring in the brain, which leads to behavioral symptoms that cause an individual to behave outside the scope of what is acceptable to themselves, and that has repercussions outside of the individual as well.
The hospital goes by the ASAM definition of addiction, which is the American Society of Addiction Medicine, where we look at addiction as a primary chronic disease under the ASAM definition of brain reward, memory, motivation, and related circuitry. And dysfunction in that circuitry is shown in the pathological behaviors that we see in addiction as they pursue the reward of the relief of taking drugs or alcohol.
First and foremost, we would describe it as a primary illness. We know it is a brain disease. And I think oftentimes people really misunderstand that. Stigmas and perceptions have led people to believe that it could possibly be a morality issue. And because the disease has behavioral symptoms, oftentimes people misinterpret that. But what we do know in particular, especially from the advances over the last 10 years, in particular in neuroscience, is that this is absolutely a brain disease, and that it has a set of symptoms, and that it can be treated.
We still don't know a lot about exactly how this disease progresses and how individualized it progresses. What we do really have to embrace and understand is that it is a primary disease, but there is hope. It's kind of interesting that we debate this issue constantly. And as I tell people, I don't really understand how television works, but it doesn't stop me from enjoying and watching it.
Features of a disease would be something that's not related to a physical injury and has many factors involved that can influence the disease to grow and spread. It is debilitating in the sense that it impacts somebody's functioning to the point where they are having significant difficulties coping with life.
Well, the disease model we know in medicine essentially states that in order for something to qualify as a disease, there has to be an organ involved, there has to be a defect in that organ, and then there are symptoms because of that defect. So my understanding of addiction is that the defect is the brain, more specifically the frontal cortex and then the midbrain or the limbic system. The defect is an effective downregulation of dopamine receptors in the midbrain and a deterioration of pathways in the frontal cortex where coping skills and stress relief and ability for self-care are. And then the defect is the behaviors we see in addiction, so the inability to control their use of substances, persistent use in spite of the negative consequences, cravings, physiological obsession.
With any kind of disease, whether we're talking about this one of addiction or medically, what we're finding basically is when someone has a disease of some kind, that basically means that something in the body isn't working the way it's supposed to. In the case of addiction, what's happened is unfortunately there's been a change in the midbrain that is very different than most other people tend to think about. To be short about that, literally what's happened is that in our midbrain there's a structure called the nucleus accumbens. There's been a change in that for folks that deal with addiction that folks that don't have addictions don't have.
A disease, if you go by the medical model, affects an organ in the body. In this case, addiction affects the brain. It makes it not function correctly. It doesn't matter if it's a substance or an activity, but it causes neurochemicals in your brain to make your brain function incorrectly.
Somebody that is bound to a substance or bound to a situation or bound to a set of activities that's detrimental to their health, that they can't stop doing in spite of poor consequences without some type of intervention from somebody else?
It is biological in the sense that we're able to take images of the brain and look at different areas where the brain functions differently in folks who have a substance use disorder versus others that don't. Sometimes, I mean, for the loved ones and for the people around them, you can become angry and frustrated, and it seems like you're working with someone who acts against all rational thought.
I think one of the biggest pieces about the sort of debate, if you will, is addiction and disease. That's been closed. The medical evidence is absolutely overwhelming. For us, it's really in part learning, okay, how do we treat this as the disease as it is? Once we kind of get that solid, everything else is going to fall from that. When it comes to, kind of how folks contract this disease and things of that nature, we find genetically, someone has a brain that is sensitive to a chemical called dopamine. Dopamine is one of 40 different neurotransmitters that we have floating around in our head. Only 4 of them make us feel good. Dopamine is one that does a couple things. Number one, all drugs of abuse, alcohol and all other drugs of abuse affect it. And secondly, too, the thing about dopamine is it marks something as being rewarding and pleasurable. Basically, it tells our brain this is good for our survival. And so what winds up happening is that folks basically are born with some sensitivity to dopamine. When someone uses, whether they're drinking or using, there are large amounts of dopamine that get basically dumped into the reward and pleasure system. When that happens, and happens enough, that change happens in the nucleus accumbens, and that's how folks get this disease.
It's important to acknowledge addiction as a disease, just so we can break down some of the stigma that surrounds those who are in the throes of addiction.
I think that it's more accepted in terms of when we say it's a disease, people don't necessarily groan and grimace and roll their eyes like they used to. But to say that we're treating it like a disease, I think is still a fallacy.
When we think about it as a disease, it really helps us to focus the anger on the disease, not on the person, and to begin to step back and treat them with compassion. It would be similar to if you were working with someone with dementia who becomes angry or aggressive sometimes. It doesn't mean that the behavior isn't challenging, but we can step back and say, I know that this isn't the actual person. This is how the disease is manifesting at this time.
Addiction can be a disease of choice at first, but much like heart disease, where we can experience a degree of heart disease through some poor personal habits, eating a lot of McDonald's, not exercising. Once we have that disease or diagnosed with that disease, it takes some type of medical intervention to correct it. Yeah, we might not exercise, yeah, we might eat a lot of bacon, but we might still need a heart catheterization. I think that's the same thing for addiction.
When we talk about public health outcomes and things of that nature, with most diseases, if the public invests $1 into that public health concern, usually a good outcome is that the community receives 4 back. Oddly enough, with substance abuse treatment, that number is 7.5.
We might have made some poor choices. We might have made less poor choices than somebody else had made, but we're just genetically predisposed to being addicted to substances or circumstances quicker because of who we are genetically or where we grew up. But that doesn't mean that to get better, we don't need some type of medical intervention.
I don't think we treat people with the disease of addiction the same way that we treat people with the disease of cancer or the disease of diabetes or the disease of anything else, because there is a part of society that still holds on to this idea that it's all choice and that these are generally just kind of bad people. If we're really going to say it's a disease, then we really need to treat it like it's a disease. And that means that the behaviors that come as a consequence of the disease should be looked at just as that, instead of bad behaviors, bad people.